Thanks, Sue, and good evening, everybody. Thank you for the introduction. Thank you for the opportunity to talk to you about the National Bereavement Care Pathway, or to give it its full title, the National Bereavement Care Pathway for Pregnancy and Baby Loss. So, as was said earlier, you know, I work for SANS with Clare, SANS being the Stillbirth and Neonatal Death charity, was society, charity now. And we've been working very closely with a number of charity partners across the UK over the last 3 years or so to really develop pathways of care for those whose baby has died, for those who've lost a pregnancy. So although SANS core areas are around stillbirth and neonatal death, as Claire said, we are there for anybody affected by the death of a baby. And of course, there are more than two experiences of loss. So actually, the pathway covers 5 different areas. It's miscarriage, including ectopic and molar pregnancies, termination of pregnancy due to fetal anomaly, TOPFA, or for medical reasons, stillbirth, neonatal death, and indeed the SUDI deaths, the sudden unexpected death in infancy up to 12 months. And so working with those partners and with our Royal College colleagues as well, and we started to pilot the bereavement care pathway in a number of sites in England towards the end of 2017. Some of you who are watching may be from one of those 11. And then in 2018, a further 21 came on board, so there are 32. And we're up to 66 now, which is around half of the England NHS Hospital Trust, which we're really thrilled about. And of the remaining 60 or so, well over 50 have already formally expressed their interest in the bereavement care pathway. So we know that it is catching on. The evaluation, as you rightly said, Sue, has really recorded the impact that the pathway has had. So why did we do it? Well, actually, and just to clarify something you said at the start, so Baby Loss Awareness Week is in October of every year, and that is a real focus on baby loss. There's a number of different charities that come together, and there's a number of events that are held. There's awareness raising online. There's a debate in Parliament, and really that from Baby Loss Awareness Week was formed the all-party parliamentary group in Westminster. So it was a group of politicians who knew, either through their own experience, family, or constituents, that there were really excellent pockets of bereavement care across the country, but that it was perhaps inconsistent. So they asked SANS to lead on behalf of that group the development of a national bereavement care pathway to improve standards, but also to ensure greater consistency. So regardless of whether there's an early miscarriage or a late stillbirth, the pathways in terms of the care, the standards, the approach, the parent-centered empathetic approach Claire's been talking about would be adopted regardless of the nature of loss. And that would work from team to team, unit to unit, hospital to hospital, and indeed from country to country within the 4 nations of the UK. So we developed the bereavement care pathway, and it's great to be able to highlight it this month, which is SANS Awareness Month. So this month is specifically about SANS, the charity. Baby Loss Awareness Week is still taking place every year in October for a week. So as we developed the pathway during 17 and 18, and indeed into 19, and it was at Baby Loss Awareness Week, October 2018, where we developed and we published 9 core bereavement care standards that we feel, and we felt, and we still do, should be adopted by all trusts. And you begin to see these now within the Care Quality Commission's inspection framework for maternity services, and we'd like to see it in other inspection frameworks too. But essentially what we have called for is 9 core standards, minimum standards around pregnancy loss and the death of a baby. The first 3 relate to parents, as you might expect. And I should add that all along we've had a parent advisory group that have helped us to develop all the aspects of the pathways. And later you'll be able to see where you can download the pathways from. And parents inform all of our work, as Claire's already highlighted on a number of occasions this evening. So the 3 standards that specifically relate to parents are about informed choices. So really important that you know, as healthcare professionals, what choices are there for parents, be that around post-mortem consent, for example, be that around some of the options around lactation, as Claire described, or suppression of milk, around the ability to take baby home, for example, after it has died. So it's just making sure that parents are aware of all the choices that are available for them and giving the opportunity to make that choice, or indeed to go back to them perhaps the next day or a day or two later and ask if that is still the case. Photographs is a great example of that. Secondly, then, and I'll talk a little bit more about making memories in a moment or two. So let's jump on from that and talk about bereavement rooms. Some of you will work or be familiar with hospitals where there are bereavement suites, and these are separate rooms, often away from the labour ward, where there are crying healthy babies and joyful celebrating families, for mothers and partners and families to be with their baby and on their own, away from those busy wards, to have time and space to make memories, to be in that safe space, potentially to recover from surgery, and to have some really specialized care from a team of midwives, in many cases a specialist bereavement midwife. But we also feel, and hence we've called it bereavement rooms rather than bereavement suites, we also feel that the same should be true in other areas of hospital units as well. So a separate room where a mother and partner can go, after learning of an anomaly, perhaps at the initial scan, bad news being broken to them, and time and space just to consider their options outside of and separate to a busy clinic full of waiting patients, etc. So really important that there's a separate space for mothers and families to be. The second set of three, if you like, relate to professionals, to yourselves, and to students. We feel very strongly that there needs to be a bereavement lead in each hospital trust or board. So yes, a specialist bereavement midwife, fantastic, or a lead neonatal nurse specialising in bereavement, fantastic, but actually a lead for the organisation who will oversee the bereavement standards that have been implemented, the development of the bereavement care pathway, training, resources, rooms, opportunity to make memories, etc. Someone who can oversee the delivery of high quality bereavement care standards within any given trust and tie in with chaplaincy or the overarching bereavement services, for example. That's really crucial as a role. Next, that there's bereavement care training. Obviously, this evening helps towards that and is maybe a stepping stone to a whole day training session that SANS can provide. Although at the moment we're doing those online because clearly there's been an impediment through COVID, of course, that prohibits us from going onto site at the moment and delivering a face-to-face training session for 20 staff or so. But training specific to bereavement care around the death of a baby, really, really vital that we feel. Then that there is support, as Claire has talked about, for you as healthcare professionals, someone and somewhere you can go to share your experiences, to be able to offload a little, to have some peer support, some supervision, and some care for you, so that, as Claire was saying, your cup is fuller, so that you're able to pour that for others. And a reminder here that SANS is here for you. SANS is there for anyone affected by the death of a baby, not just families, but staff too. So if you've had a particularly difficult shift, for example, do give the helpline a call, and we'll only be too willing to talk with you. And those resources must be there too. And that could be guidelines, it could be the availability of online resources, or some of the tangible items to help make memories. And so that's 3 for parents, 3 for professionals, and 3 for process, 3 Ps. And so there we believe there should be a bereavement care plan that is parent-led, relating back to informed choices, but there's a plan that enables continuity of care for parents, so they're not moved sort of from one team and one person to the next, having to tell their story over and over again. That things are written down in terms of the choices they've made, and it's very clear that is parent-led. And related to that, there should be a system to signal that there's been a bereavement. Some of you will be familiar with the SANS teardrop sticker that is put on the mother's notes to denote that there has been a bereavement, and those are well received. And they're just a simple thing like that makes a big difference. Or in Liverpool Women's Hospital, you know, there's a lanyard, for example, that has the honeysuckle suite written on it, and it's just an indicator for those who wish to have one, to staff, that this is one of our families who has suffered a bereavement. And then finally, that there should be assessment and referral for emotional and mental health, as Claire said earlier as well. So there's kind of the initial bereavement care that you can provide in a hospital setting, but then longer term, before they leave that hospital setting, you know, we feel there should be an assessment of needs made around emotional and mental health, particularly for those families for whom, you know, they may not have the support network that others have, and be able to refer on to more specialist support. So those are our 9 standards that we ask trusts and boards to adopt. Now, I mentioned making memories, and some of you will be very familiar with this concept, others perhaps less so. And making memories are really so important. It came through in 2 or 3 of those videos that were shared. You know, that one towards the end with the bereaved dad saying, "Thank you so much for enabling us to have 6 days with Isaac," where we were able to make memories in such a difficult time. Photographs and videos. There are wonderful people who come in and take a free set of photographs, maybe lovely black and white or colour, of course, photo of the parent with their baby and perhaps the family. Or maybe you have a camera that you've been trained to use to take some nice photos. And again, for some, that seems a strange concept. Why would you want to take a photo of a dead baby, frankly, as one of the mums said earlier? But actually, those are so treasured by families for years and years and years. A memory box of items, SANS can provide those. There's an example of that down below with the teddy bears there, a little keepsake, a bracelet, some information, some leaflets, the certificate of birth, and information around SANS. And, you know, some will take a lock of hair and put that in their memory box, or what have you, various memories of the baby, and then get that out over time and share those. A memory book, perhaps, relating to that. Music, the opportunity to bath the baby, and the opportunity for families to visit. But above all of these, just draw your attention really to that second one about time, because parents say to us that much as these tangibles are really special things for us to have and to cherish and to keep, just the opportunity to have time and space and room with our baby and with our family at the most difficult of times is as precious a gift you can give us, as the dad said there in the video, as the things themselves that we're describing. So taking time to help families make memories is a wonderful thing that you can do. So that is a very short whistle-stop tour of the bereavement care pathway, or pathways. You can find out lots more about it here on nbcpathway.org.uk. If you go to nbcp.org.uk, you end up at a caravan park in North Wales. So you need to get it right. It is nbcpathway.org.uk. Or if you're in Scotland, you can use nbcpscotland.org.uk. Those are the second and third slides there. We have a number of online learning modules for further learning, which we've developed through the pathway, through the training group that many charities and rural colleges have been involved in. And many of you will have an e-learning for health account, and you can go onto that and just click in National Bereavement Care Pathway, and you'll find 2 modules. One is specifically for healthcare professionals, 30 to 40 minutes, quite detailed around the NBCP. But actually, you can tell friends, family, neighbours, teachers, social workers, your MP about the first module, which is only 7 or 8 minutes long, and it's an introduction to bereavement care after the death of a baby. What do we say? Finding the words, as we've been talking about. And then in addition to that, at the top there, we've included a website. If you just go to SANS, though, you'll see it there flash up. We've done some specific work around bereavement care during COVID-19, and a number of you will have kindly already filled in a survey that we've been circulating about what a difference COVID has made to the provision of bereavement care. Some of these things, some of these standards, the memory-making possibilities we've been talking about have been naturally affected, the ability to deliver those, by the pandemic, the ability to use a bereavement suite, to have capacity to attend training. There's more information there about the training workshops and webinars that we're able to provide. And if you so wish, you can follow us on SANS Insights and SANS UK, as Claire mentioned earlier, and there's our personal ones where you can find out lots about bereavement care and the work that we do during the week, as well as running and swimming activities at the weekend, I'm sure. Thank you very much.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.